Dangers remain in Cambodia as it recovers from war. One of them prowls above the roofs of Phnom Penh. It is hidden. It is insidious. It carries with it all the ingredients needed to endanger the health of the people. Every morning, unaware of the dangers, children come to go through the city's garbage. They find used injection materials, syringes and needles from the health facilities. So the first victims of this danger are the scavengers, and most of them are children. It is here, in its favoured place, we can spot this danger. In Cambodia, such used injection material finds its way to the rubbish dumps. It has a market value, and large numbers of children go to the dumps to collect and recycle it into the marketplace. And the scavengers get injured by needle pricks, which are likely to be contaminated and cause disease. To avoid this, we need to get this used injection material out of the dumps and into incinerators, where it can be burnt in an environmentally friendly manner.
When I'm scavenging the garbage, I find some syringes, needle and drugs packed into plastic bags. I just keep the syringes in order to sell them, but I need to break the needles to get syringes only. My fingers are wounded every often, and my friends here have the same problem.
The safe disposal of syringes is not only to prevent diseases among scavengers, but also among the health staff and their patients. We call this injection safety. There are three major types of injection equipment being used in Cambodia today. The first is what we call reusable equipment, needles and syringes which are sterilized over and over again. If done correctly, this is very safe. The second is the use of disposable syringes and needles. They should be used only once, yet we find they are recycled for resale. We suspect such recycled syringes are not always properly sterilized. The third type is the new form of auto-disable syringe being introduced into Cambodia. You cannot refill the syringe once it has been used. It is automatically disabled.
When using auto-disable syringe, after you pull the piston back to draw vaccine and push it forward to inject, the piston becomes locked and can no longer move. This means the syringe is unable to be reduced.
As everywhere in the country, we face personal health and security problems using syringes. We hope to have systematic use of one syringe for one injection. Unfortunately, the actual running costs for the self-injection practice are so far too high for our country. So in the time being, we keep sterilizing the injection equipment.
To show these things, we went to various health facilities to look at their injection practices. In a health facility near Phnom Penh, the medical staff dispose of the syringes and needles properly after every single use. Such safe injection practices are hazard-free for the patient as well as for the health facility staff.
សម្រាមរបស់យើងយើងចែកជាពីរផ្នែកបើសម្រាមជាឧបករណ៍
We have got two kinds of waste. The domestic waste generated by the patient. These are normally collected into dustbin and transported to dump sites, and medical waste, and also all kinds of injection equipment. Our incinerator destroyed these medical wastes.
In some health facilities, they assume that all used injection material is destroyed on the spot. However, in reality, this is not always so. Here, you can see the syringes and the needles in the dustbins in the corridor and on the floor, accessible to anyone. This is not good. On visiting this hospital, we can see the urgent need for a real effort on injection safety. This would include training of the staff and the use of incinerators. Presently, much of the medical waste, including used injection material, reaches the local rubbish dump or is just thrown away. It is essential that we dispose of this waste in a safe and environmentally friendly way. We must not allow this kind of material to be where children can pick it up either to play with or gather for resale. Often when patients are very poor, they do not believe they can afford to buy separate disposable syringes for each of the many injections of medication. So they buy 2 or 3 and ask the nurse to use them over and over again. But the question is, does the nurse know which needle went into which person? This is a hazardous practice induced by people's poverty. The medical staff is aware of the problem. Unfortunately, that is the way it is.
We face a lot of problems in the hospital. Generally, we have to dispose of the used syringes and needle into dustbins. It is not a good way. We should not allow this needle to be accessible to the public. Also, for the routine immunization, we don't have any disposable syringe. And about our dustbins, they are not well maintained, and some syringes brim over. Sometimes, children find it and use it as water gun. This induces frequent stick injuries.
សារ៉ាងដែលប្រើប្រាស់វាមានពិភពច្រើនកន្លែង
Private medical structure accused of illegal practice, as well as those that do conform to the law are responsible for the tip out of used syringes at the dam. If private clinic do not have an incinerator to burn its used syringes, it should collect it into a container and then a private transport will carry it to dump site.
ដូច្នេះសម្រាប់នេះអាចចូលគ្នាទៅដល់ស្ទឹងមានជ័យ
Indeed, huge progress has been made in some health facilities in terms of medical waste management and injection safety. What we observe here appears to be quite effective. This can be achieved in other health facilities. Improving the situation is a priority for the National Immunisation Programme, with support from WHO and other partners.
In our hospital or the various services, do use brand new syringes. We are trying to utilize one syringe for one injection. We do have plastic safety boxes to collect used needles. When these boxes are full, they are collected into red bags to advertise their specific use. These are then burned in our incinerator.
In spite of these basic precautions, separating the syringes and needles is unsafe. This is when the medical staff face the highest risk of needle stick injury. So you have seen some of the current practices. The best solution available is the combination of auto-disable syringes, safety boxes for syringes and sharps, and incinerators. The National Immunisation Programme is using such syringes and safety boxes, which are then disposed of in safe incinerators in all provinces in Cambodia.
The Ministry of Health with the World Health Organization have prepared the supplementary immunization activity in order to prevent the spread of different diseases. We use auto-disable syringes for all the injections, and we have safety boxes to put in the used auto-disable syringes. Then we dispose of the safety boxes in safe incinerators. We will not see any more syringes and needles all over the street or mixed with the garbage. We worry because the children stick themselves when they try to recycle it.
Every day, in some district of the country or another, health workers go out from their health centre to reach their community as part of their outreach activities. You can see that even in remote and difficult conditions, these new auto-disable syringes and safety boxes can be used to give safe and clean injections.
I am very satisfied with this project because we use syringes that we put immediately into the safety box after the injection is made. It also makes me happy that we prevent sticking ourselves with the used syringes.
The problem is that many people do not understand the danger of unsafe injections. Many feel that an injection is like magic, and with good magic, no harm can come from having an injection. This may be why many mothers seem not to worry about the safety of injections. Because many people are unaware of the unsafe injections, it is our responsibility as health workers to give a clean and safe injection every time and make sure all the used material is destroyed.
However, to ensure that this program continues along the same lines of implementation, it is imperative that WHO is able to secure funding to continue to implement injection safety, including the installation of incinerators at provincial level. These incinerators are being used to ensure that we properly destroy the equipment in an environmentally friendly manner. And to ensure that we do this, we presently have a team here from Japan who are testing the emissions for any toxic elements, including dioxin and furans. This project has been going for a number of years, 2 or 3 years here in Cambodia, and we will be expanding this program into other countries. So it's going to be critical over the next few years that we secure funding to ensure that all injections given within the EPI program are safe.
Clearly, in Cambodia, there is need and opportunity to work together to protect the lives of the generations to come. Perhaps for children such as these, it may be too late. But can this be an excuse to do nothing? We can see the problem, we can see the solution. Working together can achieve injection safety. WHO, UNICEF and others are pleased to be able to support Cambodia in this exciting work.